I'm Corey. I am a clinical social worker here at Lenox Hill Hospital. I also do private practice outside of here, but I support oncology, and that includes radiation oncology and neurosurgery, which are the two departments I spend most of my time with here at the hospital.
Great. What kind of services do you provide in private practice?
Psychotherapy, so just traditional individual psychotherapy, and I also do couples therapy as well.
Oh, excellent. Okay, great.
Yeah.
And Brittany, it looks like isn't online yet, but she'll be here shortly. Basically, the way this is working out is that, you know, the COVID-19 pandemic really changed how we practice medicine. And not only how us as physicians or practitioners, you know, perform medicine, but also how we think about illnesses. And then it's also, you know, changed the, the patient experience and what the patient's going through. And now I'm a brain tumor specialist. My senior partner, John Bookvar, who may or may not be able to join today, is a brain tumor specialist. And we realized that patients dealing with cancer, and specifically, you know, tumors of the brain and spinal cord, have additional kind of questions outside of the normal questions being asked by people everywhere. And so, you know, we thought, you know, other diseases exist. COVID-19 is not the only thing out there. And we wanted to provide a forum to provide support and resources and just, you know, let people ask questions and have a discussion about what's going on and how it affects them in particular. Now, there's obviously tons of anxiety about this and uncertainty. And so the real goal here is to be a support system. And so a few things. First of all, it's a conversation, but the only people able to talk are actually myself and the guests. And so there's a chat feature at the bottom of Zoom where you can actually ask us questions and we'll respond in real time. We've got a few questions already submitted that we'll get to. And the other thing is, you know, a very, very important thing. If you're having symptoms, neurologic symptoms, you know, weakness, difficulty speaking, if you have a tumor and you haven't seen your doctor, if you're at all worried that your disease is progressing or you're concerned that you might have a disease, you got to get checked out. Now, obviously, there's a lot of fear about going to hospitals right now, but there are mechanisms in place to make sure that your care is safe and, you know, adequate and, you know, really exceptional when necessary. And so, you know, with that, we're going to kind of open it up to questions coming in from the group and outside. And when Brittany gets here, we'll let her introduce herself as well. I guess, Corey, you know, what are you seeing now? You've been obviously repurposed. Can you tell people a little bit about that? And also, you know, how you're doing what you did previously at the same time?
Sure. I am now covering inpatient units at the hospital. I'm covering 3 of them. They're currently non-COVID, which makes social work a little bit easier. I was doing the COVID units, but now non-COVID. It's hectic and crazy, but manageable. The hospital climate is starting to sort of just acclimate, and it now, fortunately, seems very normal and routine. Yeah. Prior to being repurposed, and I look forward to returning, hopefully quickly, it was actually a really unique role. I think I have the best position in the hospital, and that as an oncology social worker here, Dr. Bookvar, who is a neurosurgeon, you know him, and Dr. Techie, who is the radiation oncologist, I mainly spend most of my time with them. And how sort of my day looks is that when I'm with Dr. Bookvar, I go in with him to all of his GBM patients. So I go through, I listen, I'm right there as they're receiving information, going over, you know, all the tests, et cetera. And then Dr. Bookvar and his nurse practitioner leave, and then I stay. And so it's sort of like a warm handoff. So I'm able to observe sort of what's going on in the room then, seeing how they're hearing the information. And then I stay and I get to clarify sort of what was said, what wasn't said, what they heard and what they didn't hear. And then we sort of just talk about the anxieties about having, you know, a glioblastoma, cancer, and all those things that come with it. So I get to address the sort of immediate anxieties and stresses and the concerns that people have related to cancer. So would there be just psychosocial support down to transportation or financial resources? So with Dr. Bookbar, before they leave, there's like that warm handoff. And then if they need to continue the conversation with me, I'm able to schedule time for sort of informal, or traditional sort of like therapy in an office.
Yeah. Listen, you touched on a lot of great points that I think are really important during this time. So right now, obviously, patients aren't coming to the offices. The clinics, elective surgery has been canceled. Clinics have been canceled for the most part. Now, how are you following patients at this time? Are you doing telemedicine with Dr. Bookfar? Are you following independently? What options are out there, I guess, for patients?
Sure. For neurosurgery, Dr. Bookfar is doing telehealth. In terms of me, because I am not, which is great, is that I'm not a billable service with the hospital. So I can spend as little or as much time with the patient, since there's not a fee attached to it. And so I reach out telephonically to them. I do wish it was sort of telehealth, because there's a lot you get from seeing a patient. But it's telehealth, and I've been reaching out basically bi-weekly, because that's really covering the hospital and this. It's a little overwhelming, but I'm reaching out telephonically.
Yeah. Brittany just signed on. Why don't we have her introduce herself too? This is my second guest today. I think you're muted, Brittany.
Uh-oh. It says I'm muted by the host.
You're better now.
Okay. Sorry about that. I was on another call. So I'm Brittany Lamonda. I'm a neuropsychologist at Lenox Hill Hospital. I work predominantly with patients who have any kind of brain illness or injury, neurological populations, patients with epilepsy, but I've been doing some telehealth with COVID patients and some other telehealth outpatient visits as well.
Great. So what kind of change have you seen in what your day-to-day is like?
It's vastly different. So I normally do cognitive assessments with patients in the office, and we can't really do that via telehealth. It's just not, we don't get as good data. So I've sort of been trying to offer support services to our outpatients. A lot of the patients in our service are prone to anxiety or depression, and they're just really having a hard time adjusting to a lot of the, the new quarantine and social isolation piece of it. They're concerned about their health. And then, obviously I usually don't do inpatient telehealth with COVID patients. So that's also been a new service that I've been offering.
So, both of you are having interactions with patients. I guess, I think the big thing is, what are people asking you? I have a feeling that anyone listening is going to have the same questions that you've heard already. So Corey, specifically, why don't you start, since you deal with the cancer community, obviously on a kind of really practical basis. What are people asking you?
Sure. Some are really, really basic sort of questions, like, can I sleep in the same bed as my spouse? Is that safe? Should I be riding the subway? A lot of those are like medical questions, and, I can't answer, but they're like scared, it seems like, and afraid to ask their medical provider. And then some of the things they're asking me, like, should I go to this appointment? Should I go to chemo? Is it safe? So there's that. And then, for those that are sort of in remission, or they've done all their treatments that I still do follow-up care with, I think there's some anxiety about, like, well, I beat cancer, I can't let this get me. So now there's this new, fear of a different C, but, COVID.
Yeah. Yeah. Brittany, what are you seeing?
Yeah, I just find like people they feel so isolated and alone, and they just have so many questions about how long this is going to go on for, how it got to be this way. People just sort of want to vent that they feel frustrated, that they don't have answers, that they don't understand the virus. Going along with what Corey said, lots of questions about, thinking someone in the home might have been exposed to the virus or had the virus, and can we use the same bathroom as them? And, just lots of questions about safe practices. Then there's a lot of people who just say that they're really having a hard time coping with this, that they feel alone, that they don't know how to get groceries, that they haven't been able to see their loved ones, that they're not sleeping well, that they're unable to exercise, that they feel like they're overeating, all these unhealthy behaviors that people engage in to cope. So, really trying to discuss the importance of maintaining a schedule and utilizing healthy coping strategies, relaxation, meditation, etc.
Yeah. I think we touched on a lot of this stuff last week. We had a radiation oncologist, Dr. Swietecki, and a neuro-oncologist, Dr. Debbie Gruber, on. And, we went over a lot of the kind of ways that patients can keep themselves safe, and kind of understanding that a cancer patient might be at a slightly higher risk than the general population, whether it's due to the chemotherapies that they're on, the radiation therapies that they're on, and how they could be extra careful. And, the National Cancer Institute has guidelines for this, and they're, fairly intuitive. It's basically keeping yourself safe from infection. So washing hands, social distancing, which, is really being enforced at this point. But I guess, the question that comes to mind, especially since, you guys are both kind of experts in this field, is the stress of dealing initially with cancer, and then, having that underlying as, basically probably dictating your everyday, and then having on top of that the fear of dealing with COVID. And it sounds like both of you are seeing that. Is that right?
Yeah.
We have a very special guest on the line here. Dr. John Bookvar has joined us. How you doing?
Hello.
Hi, Brittany. Hi, Corey. Hi, Randy.
How you doing? Hey, so we just started talking. Basically, Corey and Brittany have introduced themselves, kind of talked a little bit about how their practices have changed, what they're seeing. And, really today, I think, focusing on the stresses associated with having a diagnosis of a brain tumor or a spinal cord tumor, and dealing with the fears and kind of the anxiety that COVID brings. What have you seen in your practice so far?
Well, I tell you, it's very tricky, and it's not just for glioblastoma or brain cancer. We're tackling all of cancer across the spectrum, and actually, it's a little bit easier when you're talking about central nervous system cancers, because there's a lot more urgency and emergency to the diagnosis, let's say, of brain or spinal cancer. What is even more challenging is, what do you do with a breast lump or an abnormal mole, or something that is a little less emergent? So frankly, we have to balance, and I spent some time on the phone today trying to balance the risk. I had a patient who has a brain tumor, but he's got COPD, which is a lung disease, and he's an older than 65 male who's heavy set. That patient is at a terrible risk for COVID-related complications. And so we would not want that patient to come into our hospital until at least June or July. So we're pushing that back until June or July. So it's a very challenging time to balance these issues, not just for brain cancers and spinal cord tumors, but also for every other cancer diagnosis, even if it comes back to imaging, when to image, to do mammography, to do biopsies. And our hospitals are completely filled right now. So we have about 1,000 neurological cases just in Northwell alone that need to get done. And so it is a challenging issue, but frankly, cancer is an emergent and urgent issue.
Yeah, absolutely. I think that's one of the things we've been stressing here, is you can't ignore the symptoms of your disease, and you can't ignore your disease, and COVID's not the only disease out there. And so I think we try to stress in general that patients can get to hospitals safely, and there are mechanisms in place, whether it be triaging, like you're talking about, making sure that your patients with underlying lung diseases are going to, be safely triaged to get their surgery, versus actually once they get here, wearing masks, wearing gloves, providers and, advanced practitioners and the whole staff really keeping patients safe as well. And I think that relieves a lot of stress. Corey, I mean, what are you seeing in terms of, what the department's doing right now, and any ideas of what we should be doing differently, since you're kind of tackling, direct patient contact?
In terms of doing things differently, I wish that we could offer more actually sort of visiting in-home services. I think I'm not sure if that's possible. I wish it was something. I know that we are trying to mitigate risk.
You guys are on fire.
Someone sharing their screen.
Did I just do something?
I think we're seeing your Google.
Oh, sorry. How do I change it? How do I fix it? Sorry, guys. I'm so technical. Okay.
You guys stopped.
Sorry.
No problem. Corey, what else?
I think to speak to what Brittany was saying is they want sort of human connection. And so if, there was a way for the practices to do home visits, I think that would be, I think that would help leaps and bounds, especially with someone's mental health.
Yeah, that's a little difficult for obvious reasons in terms of, bringing someone, people are already suspicious, they're already scared. Bringing someone into the house would be, I imagine another stressor. Why not telemedicine from your end of things? The neurosurgery department has fully embraced this. We have a huge telemedicine kind of setup right now and system in place. And it works for us. I know, Brittany, you mentioned it doesn't really work for what you're doing, but Corey, from your end of things, why not really embrace that?
I mean, so I do in my private practice right now, only because the office is closed, the building's not letting us, but I was seeing patients up until they said you couldn't. Because I think just in terms of social work, I think it's you see someone's affective response, you see their body language, and there's just something about that connection. However, I have clients that have in my private practice that have switched to telehealth. They've, and they prefer it. They like that they can just be sitting at home. They prefer it. I just, as a clinician, prefer to be in person or in the home. But obviously, telehealth is, in this situation, is a great alternative.
Yeah. And then, Brittany, what in particular is it that makes it difficult for you to do with telehealth? What part of the evaluation?
Yeah, so when we're doing cognitive testing with patients, they have to look at different stimuli. They have to manipulate certain stimuli that we give them. They need to be able to draw things. So unfortunately, our measures don't translate very well if you're not in person. You can do very brief screeners, but they really don't tell you much, and you end up saying that you need to have them come back for repeat testing anyway in the outpatient setting. But what we have been doing is we've been doing intake interviews, which sort of gets that piece of it done because that's part of the assessment. And then we've been offering feedback to patients who we've already done the testing with in the office, and then been doing the telehealth with the inpatient with inpatients with COVID and other patients who have anxiety. Our docs will just refer them to me, and then either video or telephone. We'll call them and provide them with different strategies and tips and techniques to try to help alleviate some of their anxiety. What I'm seeing a lot, and I don't know if Corey's dealt with this at all, but a lot of the folks who are recovered enough to be going home, they're nervous to be leaving the hospital. So their anxiety then creates a feeling of panic, and then they feel like they can't breathe, which is probably one of the main symptom that brought them to the hospital to begin with. So then they're telling the attendings that they can't breathe. They're checking their O2 sats and they're fine, but they're still saying that they can't breathe and that they don't want to go home. And then I'll try to do some interventions with them to help with relaxation, recognizing what's anxiety, what's triggering versus what might be an actual physical symptom of the disease, and trying to help them to distinguish between the two. A lot of them, I'm sure Corey deals with this a lot, they're anxious to go home, figuring out how they're going to get food. Some of these patients live alone, and sort of tackling a lot of their fears about going home. I usually try to tell them, being in the hospital initially brings them closer to being safe, but if they stay in the hospital for too long, it actually brings them away from that goal of being safe because there's more things that they can pick up in the hospital. So that can sometimes be useful. But actually, the funny thing, I was late for this, piggybacking on what Dr. Bookvar was saying. There actually is a patient within the Northwell system who has a brain tumor, and he's been seizing a lot more, and they actually have to do an emergent WADA that I'll be doing at one of the other Northwell hospitals on Thursday. So there are situations where these patients still need to undergo surgery, and if their conditions are just, worsening during this time. And I think that, there's probably increased anxiety about coming into the hospital to get these procedures done, but sometimes they really have to be done.
So have you spoken to that patient yet?
Not yet. I will.
Okay.
And yeah, he's a young guy, so it'll be interesting to see how he feels about all of this.
Yeah, absolutely. What do you anticipate, his questions are going to be?
I think probably pertaining to, safety and how long he'll be in the hospital. Everybody will be wearing N95 masks, him included, but just, concerns about, I think, a lot of like the patient areas, the holding areas have now been turned into ICU. So there's a question of where is this patient even going to go when they come into the hospital? Are there safe parts of the hospital where non-COVID patients can go? What have they been repurposing different ORs or angio suites for if they've been using them for COVID patients? So, trying to alleviate some of those anxieties. And then obviously if he's having more seizures, he's probably super anxious about that as well. And I obviously haven't gotten to meet this patient. So that's another thing when they're coming in for some of these scary procedures and they haven't even met the provider, that can even be more overwhelming.
Yeah, absolutely. So, I mean, you touched on another thing before that I wanted to get back to, which is this idea of, am I anxious or do I have the disease? And how do people recognize that they're anxious? What are some of the things that you look for if you're stressed out about this? Maybe you don't even know, right? Maybe there are certain things happening in your life.
Yeah, so I mean, I think one that's been in the news a lot lately has been this idea of nightmares or very vivid and disturbing dreams. So if you're waking up in a cold sweat, or you're waking up and just feeling off and then sort of remembering this crazy dream you had about contracting the illness or a loved one contracting the illness, it might be that you're having a lot of these unresolved anxieties. So we recommend that you talk about it, that you journal about it, that you try to think about what might be at the root of this anxiety. Sleep is really important for the immune system and for brain health. So making sure you go to bed at the same time every night, not watching the news before bed is another big one. I think we see all these apocalyptic images of, hospitals in Central Park and people just geared up, and that can be scary, especially if, we're looking at that right before bed. So I think nightmares is one thing. If somebody's isolating more than they're supposed to be, so not answering FaceTime calls, not connecting with others, that can be another sign that the anxiety is really bad. Binge eating is another one. People just sort of, if they feel off, there's not this homeostasis, you might try to like overeat to have that feeling of control. So any of these unhealthy behaviors, I think, are signs that something's off. And, as Corey was saying, many providers are offering telehealth consultation and services at this time. So if somebody's feeling like they're not handling this well, then they should really reach out to a professional.
Yeah, Corey, anything to add?
To follow up on that, I will say New York State is offering really awesome programs. I know the New York City chapter of the National Alliance for the Mentally Ill has a COVID specific mental health line that if you're experiencing stress or anxiety related to just managing the current just COVID and the fears, you can call that number. I know the Department of Health and Mental Hygiene has a specific line, not just for COVID, but for sort of any mental health issues for immediate support, along with the Department of Health. So that's for like anyone. And I know that the American Cancer Society, for those that have a cancer diagnosis, all of their programs that were in person are now either tele or phone, which is great, along with Gilda's Club, which is in New York City, and it's a cancer support agency. Everything is telehealth, along with like the AA and the NAs. So there really is a way for someone to get as much support in terms of mental health and substance use. I mean, I've never seen a time in my like career in which that somebody can stay home and get all of sort of the mental health support they need. So it's
Yeah,
great.
I'm going to ask you guys, I don't know if it's possible quickly or not, but there's a chat feature on this. And if you want to put any links in, now's your time. Everyone who's in the Zoom meeting will be able to see those links. We can also publish them later on through the Lenox Hill Neurosurgery Department. But if you know websites or anything like that, the names were great though. I think people will really appreciate that. We do have a question. We've actually hit a lot of the questions just through our conversation. But one question that came in was just for patients on chemo who are already immunocompromised, how are they being affected by having to go into the hospital for treatment? And we've talked about this a little bit last time, but I think it's really important to hammer home and cycle back to, because this is primarily who we're addressing with these webinars. The truth is you probably are immunocompromised if you're on chemotherapy, and you probably are at a slightly higher risk. And so the safety measures that you have to take begin really at home before you even head to the hospital. Now, patients with brain and spinal cord tumors in particular, but all cancer patients, typically, have a caretaker who's involved with them, some sort of family member who has to come. And it's actually recommended that they come, because the stress of talking about this, you can forget a lot about what's said. So it's nice to have someone there to kind of help you through it. And that begins at home. So identifying someone who can safely take you, who has been quarantined, who's not going to expose you. You want to practice all the social distancing things that you've heard about on the news. So safe hand washing, mask, gloves. Don't take public transportation if you don't have to. Have someone bring you. And then, call your doctor's office beforehand and ask them what measures are in place to kind of ensure your safety. And I think you do have to be a little bit proactive about this. And if you can't, for some reason, maybe due to your condition or whatnot, have someone who's caring for you take care of that. Once you're there, you're relatively safe as long as the officers are taking the right precautions. And I think, Brittany and Corey can talk about the precautions they've seen when patients do come into the office during this. Most people are wearing N95s, gloves when necessary. As of now, there's no pre-screening tests happening unless you are getting a surgery. I believe all patients undergoing surgery right now are being screened or tested, actually. But in general, you really can't delay your care if it's absolutely necessary. And your doctor is really going to be the one who makes that decision for you. If it's time for your chemotherapy, if it's time for a lab draw, the doc will inform you and guide you through that. I know that Dr. Bookvar last week talked about there are lab services that will come to your house. I believe it was called LabFly, which will actually come to you and draw your labs. Again, we're using telemedicine as much as possible, as well as some apps that make things easier to communicate. Brittany, Corey, anything to add to that?
I would say with scheduling for radiation and chemotherapy here in New York City, the MTA has a program called Accessoride. And because of what's going on with COVID, they're only offering rides for those that are in chemo or radiation, which is great. And they're all individual rides, and the vehicles are cleaned before and after every ride. So it's just normally when you get picked up, there's like 10 people in the van, but now it's really just like an Uber or a Lyft kind of situation. And you could bring a loved one, and there's no charge, and it's door to door, it's clean. Whereas before it basically was like, 10 people in a van. So, and anyone qualifies. So I've been doing a lot of those referrals, and it's immediate. And so in terms of getting here, that New York City is doing an awesome job with that.
That's great.
And Randy, I will tell you, LabFly is the same way.
Yeah.
So they have a very professional Northwell lab. Person comes gloved, masked, and it's very, they, as much as they can, they socially distance while they take your blood or urine.
A very long needle, right?
You pay $19.99 and you get your labs done. So it really is terrific, particularly for the older patient who really does not want to leave the house right now. It's LabFly, and Randy can put that up.
Yeah, we already posted it.
It's a $19.99 service charge, but it's invaluable.
Absolutely. We have another question. This is from a family member. If someone suspects there's something different, a lump or some discomfort, is telehealth advised, or should that be pushed off until any significant changes occur? That's the first part. Second part is, what is some feedback that can be given to a person who has concerns for their health that are not primarily driven by anxiety? I think that telehealth is a great option that we're really embracing right now throughout medicine. There are huge benefits to it that have been looked at already in terms of things like you need less time off from your day. You can, you don't have to travel long distances. And for patients who go to tertiary care centers, something like Lenox Hill, where you're getting, you know, excellent neuro-oncologic care, you can do that from the comfort of your own home rather than traveling 2 or 3 hours. Now, if you find something different or something concerning, we talked about this kind of at the beginning of this, you really have to get it checked out. And you can't let COVID-19 stop you. At this point, through all the measures that have been acted, you can get safely taken care of by a doctor. Now, if you are immunocompromised from whatever issue, you want to take precautions. You want to call ahead like we talked about. You want to make sure that the doctor is going to be able to accommodate what's going on. Now, in terms of feedback that you can give to people who are concerned about their health, it's really the same thing. You know, even if it is anxiety or a real medical condition, you should really talk to someone. You shouldn't be afraid to talk to someone. You shouldn't be afraid of the care that's out there right now. You guys have anything else to add to that?
Yeah, no, I mean, I think that not pushing things off if they seem concerning is definitely advised. And as you mentioned, most offices are allowing telehealth options. So I think it definitely makes sense to seek out professional care and at least try to, you know, try to get it looked at from that perspective. And, you know, I think that can cause more anxiety if somebody feels like there is something different going on. And now is definitely not a time to have increased anxiety. So if there's a way, you know, a lot of what I discuss with patients is to focus on things that are in our control. So it is in our control to seek out professional help. So if there's been a change, then I think it makes sense to you know, to talk to a professional for sure.
That's great advice. Corey, anything?
I think it's really more for providers is really communicating with the patients that we are offering the service. I know from like my primary care doctor, I feel like I've been getting an email, you know, once a week being like, if you're experiencing this, and it's not necessarily COVID, but like random things reminding them that they are there. So I think that'd be really good. I'm not sure what Northwell is doing or sort of neurosurgery department, but I think it's really good to continue to advertise, because then that makes it in patients' peripheral to be like, oh yeah, I can reach out.
Yeah, I'll tell you what we're doing. It's called a webinar. You're on it. No, it's one of the things. Honestly, we've fully embraced the telemedicine, like I said, and that's on our website. We can actually put that in the chat too. You know, I think it's about communication. It's about making sure people know that you're still there, any means necessary. You know, we happen to be a department that's very facile with social media, and we use that a lot to communicate with people. You know, Dave Langer, our chairman, just gave grand rounds, you know, out at the Mayo Clinic, and you know, just getting the word out there and the names out there, and letting people know that, hey, we didn't stop, we didn't go away. Even if some of our staff members are repurposed in different parts of the hospital, this is our job. This is what we do. The same thing, I'm sure, with you guys. I want to thank you guys for being on here. We try to limit these to 30 minutes. Try to keep people, you know, engaged quickly. We'll save any other questions for next time. You can always, we'll actually change all the links to the SurveyMonkey survey site that we have up, where you can actually ask questions in advance. We'll be here every week at Tuesday. We'll have 2 new guests next week. I'll announce that later on. And you guys are obviously more than welcome to come back whenever. And thanks.
Thank you.
Any last words?
Stay healthy.
Yeah, stay healthy and don't be afraid to reach out if you need anything. I can, you know, I think my office number is on the website there, but I'm taking new patients constantly. So if anybody needs anything, they can definitely reach out.
And that's just for general counseling right now.
Yeah, so I'm sort of repurposed.
Yeah.
And I'm offering that service, even though it's not normally what I do, but we all have to sort of be deployed and be as helpful as we can be.
Absolutely.
So, yeah.
Corey, same with you or no?
Here, if a loved one comes in with any of the oncology providers, I'm involved. In terms of private practice, you can reach out, and I'm always seeing individuals and couples. Excellent.
John, anything to end on?
No, I think, look, it's just, it's a terrific way for us actually to move forward in the future. And I think it's going to revolutionize the way brain tumor patients actually are handled in the future. I look forward to the opportunity to where none of my brain tumor patients have to come and see us anymore every 2 months. I will have a televisit with them. Unless there's an urgent issue, we'll go over the films, we'll share their screens. I think there's a silver lining to this. I think having Corey and Brittany available telemedicinely, if that's a word, that's going to be just terrific for our patients. So thank you for doing this. I think it's incredibly valuable.
Absolutely. All right, guys. Thanks so much.
Thanks, Randy.
Everyone stay safe.
Thank
Bye.
you. Bye-bye.
See you next week.